its response to coronavirus.
To sign up for a new emergency alert system so that in the event of an urgent need, our public health officials will be able to ask you for your immediate assistance. This includes all physicians, nurse practitioners, registered nurses, physician's assistants, respiratory specialists, medics, LPNs, certified nursing assistants, podiatrists, dentists, anyone who has made a career in the medical profession. This is different than the siren system that's for doctors only. This is for emergency alerts for all our licensed healthcare workers. Please register on our website at illinoishelps.net. illinoishelps.net. Your fellow Illinoisans need you. Your state needs you. By signing up, you'll be joining an alert system that, when activated, will ask you to deploy to assist in our response to urgent needs during this public health crisis. Together, we truly can make a difference, and that difference will save lives. Again, I ask you to register yourself at illinoishelps.net if you're in the medical profession in any capacity whatsoever. Please go to that website and click on Register Now at illinoishelps.net. Additionally, thanks to your amazing outpouring of support, our healthcare workforce is expanding. We have now received more than 510 applications from former healthcare workers to get back into the fight. And we began sending out the expedited temporary licenses and permits yesterday afternoon. Still more healthcare workers are needed. If you have recently retired or left the profession to start a new career, please come back to work for at least the next few months to help us battle against COVID-19. This afternoon, the United States House of Representatives passed the $2 trillion emergency aid package, and we await the president's signature on that very important bill. I'll continue to work with our federal counterparts to bring in as many dollars home to Illinois as possible. I want to take a moment today to address some of the latest ideas that have been floating out of the Oval Office. President Trump yesterday went on a talk show to question whether Americans really need more ventilators to save people's lives. He did this on the same day that our nation overtook China and Italy, having the highest number of COVID-19 positive cases. To say that these comments are counterproductive is an understatement. And frankly, at worst, the comments are deadly. When I said that the bedrock of my decisions was science, I meant it. The equipment we have, the equipment we're still seeking, these are the recommendations of the best medical experts, epidemiologists, mathematicians, and modelers in the nation, all of whom have set aside their daily duties to help save as many lives as possible. We need exactly what we're asking for, perhaps more. If we don't get the equipment we need, more people will die. The president needs to use the Defense Production Act to put order into the market for ventilators and PPE. It will prioritize Americans over foreign countries and allow states on the front lines to access the equipment we so badly need. He needed to do this to activate the Defense Production Act weeks ago, or even yesterday, but it still will make a massive difference in our national health care system if he simply moves quickly. One way or another, we need these supplies. And I have a whole team of people whose singular focus right now is working the phones, calling across the world to get as much PPE, as many ventilators, and as many tests as possible shipped to Illinois. This morning, because of my state team and their hustle and working all hours of the day and night, we received another shipment of state-procured N95 masks, and they have been in the process of delivering stocks of PPE, that is our staff, to Champaign, to Peoria, Edwardsville, and Marion. We will not rest until each and every region of our state has what it needs. But without the federal government, individual states don't have enough market power to procure what is needed on their own. So I urge the President to join us in this work and take the federal actions that are available to him and to him alone. I want to provide you an update on what my team and I have been doing to ease the burden of this moment on our most vulnerable residents, our families, and our children. I'm glad to be joined today for the second day in a row by our Department of Human Services Secretary Grace Ho, whose staff has moved mountains and then some to increase the depth and breadth of Illinois' human and social services network, including easing access for newly eligible users and temporarily eliminating the renewal process wherever possible for organizations. We're also joined by Carolyn Ross, representing the nonprofit organizations across Illinois who are stepping up in this critical time. Most of you are adhering to our stay-at-home order, but not everyone has a home to go to. Not everyone has a safe home to go to. Not everyone has the same ability to put food on the table. Not everyone can stay at home with their children. These are problems that existed long before COVID-19, as did the need for a meaningful solution. But it is especially important right now that we are doing all that we can for all of our residents through this crisis. We want every eligible person to be able to access services as easily as possible. So I want to walk you through our ongoing efforts to simplify and expand the available support. As I go through these offerings, if you need any of these services, you can find more information on accessing all of these measures at our main coronavirus website, coronavirus.illinois.gov, coronavirus.illinois.gov. And please, whenever possible, do use our websites if you can. Although our regional offices remain an option for those who need them, for your own safety and that of our civil servants, I ask you to avoid visiting our offices if you can access the internet and get what you need online. First, let's talk about childcare. I announced exactly 1 week ago that we were going to make sure that our essential workers have safe daycare for their children while they do the critical work that keeps us safe. While children who can stay home should stay home, we want to make sure that every child in Illinois has a safe and supervised place to go. I'm proud to say that we've received more than 600 applications for small group emergency child care licenses from people, organizations, schools, and communities looking to help their essential workers, from healthcare professionals to grocery store employees. Additionally, hundreds of our child care homes are staying online to provide care in socially distanced settings. And now we will be providing each of the providers who stepped up in this time of need with an additional stipend, $750 each for licensed homes, $2,000 each for centers running 1 or 2 classrooms, and $3,000 each for those running 3 or more classrooms. Applications for these grants will be available beginning Monday through your local child care resource and referral agencies, and again on our coronavirus website, coronavirus.illinois.gov. Parents and guardians looking to find child care should call our toll-free statewide number, 888-228-1146. Again, that's 888-228-1146. Or to visit our Families and Children resource page on coronavirus.illinois.gov. My administration is also working closely with the statewide hospital and healthcare associations to make sure that our state's hospitals' child care needs are being addressed. I also want to talk about food access, something top of mind for so many parents as schools have closed and layoffs have skyrocketed. First, I want to remind everyone that as long as schools are closed, students who qualify for free and reduced lunch can get their meals through their local school districts. And we continue to encourage school districts to work with our Illinois State Board of Education and the U.S. Department of Agriculture to expand their programs to all of their area kids. As for programs like SNAP and the Women, Infants, and Children program, WIC, my team at the Department of Human Services is submitting multiple waivers to the federal government to deliver as much nutrition support to as many Illinoisans as possible. Already, we've been able to automatically extend SNAP certifications set to expire March, April, or May another 6 months until September, October, and November. We've also been able to waive the physical presence requirements for SNAP applicants and participants, enabling people to further reduce the time that they spend outside their homes and increase people's ability to apply for assistance online. Anyone who needs to apply for or to adjust their SNAP benefits can now do so remotely on our Department of Human Services website at dhs.illinois.gov. Again, if you need to adjust your SNAP benefits, you can now do that online at dhs.illinois.gov. We're expecting an additional $80 million in federal money to come to Illinois in April through the SNAP program. That's another $80 million of food on the table for our residents that also stimulates our local economies. That's real impact in our communities. And I'm grateful to the team at DHS for all their work to bring as many federal dollars as possible to Illinois. Illinois is also home to many residents who don't have a permanent home to stay in. DHS has gone through its budget with a fine-tooth comb and redirected millions of additional dollars to address all aspects of homelessness assistance statewide, with a focus on expanding our ability to offer temporary shelter. That's on top of the doubling my administration has done of the state homelessness prevention program over the last year. We're also increasing all of our existing state homelessness service contracts by an additional 5%. That means more dollars to homeless shelters and permanent supportive housing. These extra dollars will help our partner organizations enact social distancing measures within existing spaces. Finally, if you're experiencing domestic violence or you live in fear of it, I know how much scarier and more complicated the message of stay home might sound to you. If that's the case for you, please know that you can call our Illinois Domestic Violence Hotline at 1-877-863-6338. Again, if you are experiencing domestic violence or live in fear of it, you should call our Illinois Domestic Violence Hotline at 1-877-863-6338. Thank you, and now I'd like to turn it over to our Illinois Department of Public Health Director, Dr. Ngozi Ezike, for today's medical update. Doctor?
Thank you, Governor. And again, just thank you for your passion and your commitment to the people of Illinois. You should all know that he is an ardent supporter of science, and he's pursuing every piece of data that we can give him to make sure that he is making data-driven decisions to make the most important, difficult decisions for the people of Illinois. And I thank you for being that kind of leader. Today, I'm sad to report that there are 488 new cases in Illinois for a total of 3,026 individuals with COVID-19. Unfortunately, this includes 8 additional deaths for a total of 34 lives lost since the beginning of this pandemic. We also have additional counties that have been included in the rolls. We have 40 counties across Illinois. As we expected and as we have feared, the greatest number of hospitalizations is among individuals older than 65 years of age. And approximately 86% of those with COVID-19 who have died here in Illinois are over the age of 60. We must continue to do all that we can to protect our older adults, our grandmothers, our grandfathers, who are most vulnerable to serious illness and death. We also must make sure that there are enough medical professionals to care for those who do endure the more severe illness and the attending complications. Again and again and again, I want to thank our medical and our healthcare workers who are literally on the front lines. While we are telling the public to shelter in place, to stay at home, we are asking them to go where the patients are, to go where the illness is, to save their lives. We are asking for all licensed healthcare providers who are able to join the response, physicians, nurse practitioners, physician assistants, medics, dentists, podiatrists, registered and licensed practical nurses. Everyone, please register at illinoishelps.net. Since March 19th, over 1,000 medical and non-medical volunteers have registered to help in our fight against COVID-19. All of these individuals will be critical, but we still need to have more help as this pandemic continues. I also want to thank and offer words of encouragement to those who are providing essential services and those who are supporting the people who are providing essential services. These include people who are providing daycare for the children of those who are providing essential services. It also involves the sanitation workers who are keeping our workplaces clean. We all have our parts to play, whether it's a healthcare provider, a person providing an essential service, those who are supporting others to do their work, whether you're staying at home as you've been instructed, whether you're a kid foregoing your play date, washing your hands frequently, keeping 6 feet away of distance, all of these steps is what it will take, all of us doing this together to end this pandemic. And now I will repeat the comments in Spanish. Hoy estoy reportando 488 casos nuevos, un total de 3,026 personas en 40 condados del Illinois. Desfortunadamente, esto incluye 8 muertes adicionales para un total de 34 vidas perdidas. Como pensábamos, el número de hospitalizaciones son personas mayores de 65 años. 86% de las personas con COVID-19 que han muerto tienen más de 60 años. Debemos proteger a nuestros abuelitos y abuelitas. Ellos son más vulnerables a enfermedades. Quiero decir gracias a nuestros trabajadores médicos que están en primera línea. Solicitamos que todos los proveedores médicos con licencia que pueden ayudar en esta respuesta se registren en www.illinoishelps.net. Tenemos más de 1,240 voluntarios médicos han registrado para ayudar en nuestra lucha contra COVID-19. También quiero decir gracias a las personas que están dando servicios esenciales. Esto incluye a las personas que cuidan a los hijos de nuestros policías, enfermeras y bomberos. Nos tomará todos trabajando juntos para poner fin a esta pandemia. Con los voluntarios y trabajadores vamos a levantar Illinois. And with that, I will turn it over to Secretary Ho.
Good afternoon. Now more than ever, the value of and the necessity for human and social services is clear. Like healthcare and safety, essential life-giving and life-altering human services are not only still available, DHS is expanding and adapting access to services for individuals and families across the state who need help now. Thanks to the strong, kind, and clear leadership from Governor Pritzker, we are also working to ensure that Illinois' Human Services Network is able to be sustained through this crisis and beyond. DHS exists to ensure that the basic needs such as shelter, food, health care, mental health, services for people with disabilities, and child care are met. We have a workforce of 13,000 strong, providing direct care at psychiatric hospitals, at state-operated facilities for people with developmental disabilities, and public benefit offices all across the state. I am grateful to them for their dedication to helping our neighbors in our state through this crisis. To our nimble, responsive caseworkers, counselors, and call center agents who continue to help people every day, we thank you. I want to salute the nurses, mental health techs, personal assistants, direct support professionals, and other frontline employees whose often stressful, sometimes challenging work is even more intense during this public health emergency. During this pandemic, DHS's own employees and our network of 500+ state-funded community partners are ramping up our efforts in several areas. When families and individuals experience a challenge in their lives, prenatal to older adulthood, DHS and its partner organizations are often the first place people turn to for refuge. We reach 1 in 3 people in the state of Illinois across the state with dozens of services, and there are too many to list. So I encourage you to please visit our website, dhs.illinois.gov/help-is-here, to learn more about the wide array of supports available to those most in need. Today, I would like to quickly highlight and go into a little bit more depth about 4 crucial resources for communities across Illinois. SNAP, the Supplemental Nutrition Assistance Program, services for people with disabilities, the Emergency Child Care Program, and expanded services and supports for people who are experiencing homelessness. As the governor shared, SNAP is a federally funded program that puts food on the table for nearly 900,000 Illinois households, feeding over 1.7 million people in our state and stimulating our economy. People eligible for SNAP include low-income seniors and individuals, people with disabilities, and working families. With the recent passage of the federal Family First legislation, monthly SNAP benefits will increase dramatically, in some cases by over 90% a month. For example, a single person with a disability or an older adult with less than $2,000 of monthly income is eligible for $194 in monthly SNAP benefits now. Before the legislation passed, they would have received $16 a month. A family of 4 making less than $42,000 a year is now eligible for $646 a month in SNAP benefits. Our administration, as always, want all eligible people to receive these basic benefits, and as always, are in the fight against hunger. This is important now more than ever. The Department of Human Services has been quickly implementing federal measures and submitting waiver requests from the federal government, as the governor had mentioned, for temporary measures to increase flexibility. We have and we will continue to implement ways to help more families withstand the extraordinary pressures many are facing during this emergency. We know some SNAP participants may be unable to get to the grocery store. If you have a trusted home care provider, a family member, or friend, they may help you access some of those benefits. I would like to reiterate what the governor had noted in his remarks because it is an important point. With recent changes, SNAP expenditures for just 1 month, just for the month of April, will increase by almost $80 million over March. That's $80 million more a month, rolling up to about $300 million of federal assets and resources that are being pumped into the Illinois economy each month, while also putting food on the table of Illinois residents. While some of our offices are still open, we do urge individuals to stay at home to sign up for SNAP and other benefits online. Over the course of the past several weeks, we have been building up our virtual capacity. Please help us keep you and our local office caseworkers safe by staying home. In addition to SNAP, included among the array of services our Human Services Network provides, there are many resources for people with disabilities. More than 30,000 people now rely on the aid of a personal assistant through the Home Services Program. This program continues to promote the independence of all people who may need limited or significant supports to carry out the activities of daily living. For people with intellectual and developmental disabilities, DHS continues to make home community-based, and other residential services available for over 30,000 families. DHS and our community partners across the state serve people with physical, intellectual, and developmental disabilities and people with mental illness. If you or a loved one needs help, please call or visit our website, dhs.illinois.gov/help-is-here. As the governor shared, the Department of Human Services with the governor's office and our sister agency, Department of Children and Family Services, launched the Emergency Child Care Program that is available for essential workers who have no other options available. In these settings, capacity will be limited to the number of children per classroom and per site. Information can be accessed through the Governor's Office of Early Childhood Education and the array of websites that we have talked about today. Before I close, I'd like to highlight DHS's work to support people experiencing homelessness. Over the past several days, we have been working relentlessly to build on the infrastructure of shelters and programs that have been partners with the state for many years to meet the dynamic needs of people experiencing homelessness during this crisis, helping our partners enact social distancing measures for this population. DHS already funds hundreds of organizations who serve people who experience homelessness through shelter supports, prevention, and support.
You've been watching a news conference with Illinois Governor J.B. Pritzker, bringing us an update on COVID-19. Included in that news, 8 additional COVID-19 deaths in Illinois, 34 total lives lost in that state. Right now, we're going to Jefferson City and Missouri Governor Mike Parson.
Also, as of today, there has been 9 COVID-19 deaths in Missouri. The situation is constantly changing, but we are taking steps each day to adapt and respond. I want Missourians to know we are working around the clock to protect public health and support our citizens in every way possible. Yesterday, President Trump approved our request for a major disaster declaration for the state of Missouri, and we appreciate this quick action and his commitment of federal resources as we continue to fight this battle. To further assist with our COVID-19 response, I have also signed an executive order mobilizing the Missouri National Guard. But I want to be perfectly clear, this is not about putting Missouri under martial law. This is a planning stage operation to provide more assistance to Missourians and increase our capacity to deploy resources quickly. The Guard will play a major role in supporting state and local communities, including the potential support of COVID-19 testing and transporting equipment and supplies, just as we did during the floods last year. The Guard is prepared to answer this call again and step in to help wherever they are needed during this crisis. Today, Adjutant General Compton is here to provide more details from the National Guard. General?
Thank you, Governor. Again, thank you, Governor Parson. As soldiers and airmen and a key component of our nation's armed forces, we remain ready to fight and win our nation's wars when needed. But unlike the other components of the armed services, the National Guard's other mission is to support civil authorities as authorized and directed by the governor of this state. Let me assure the citizens of Missouri that your Missouri National Guard is ready for this mission. Let me also assure you that we are not some outside organization coming in to impose someone else's agenda on you. We are here to help you, not control you. Hell, we are you. We are your sons, your daughters, your brothers, your sisters, your dads, your moms, your neighbors. We are your Missouri National Guard. Our motto is that we train, fight, and win while taking care of each other as one team. You are part of that team that we intend to help, take care of, and I know Missouri citizens will do that for us. The Missouri National Guard is committed to the health and well-being of our citizens, service members, and their families. From the beginning, in the preparation for this mobilization, the Missouri National Guard has been fully integrated in the planning and execution of the COVID response with our state and national leaders. We are working closely with the governor, the Department of Public Safety, the State Emergency Management Agency, the Department of Health and Senior Services, the Missouri Health Net Division, and other agencies supporting and coordinating a coordinated response. Our longstanding state and federal partnerships will help ensure a rapid and unified response, and this mobilization allows us to be even more integrated and bring more resources to bear. In addition to our already ongoing coordination and integration, we have taken an aggressive approach to preventing the spread of the virus amongst our own forces in order to ensure we are capable and ready to respond to the needs of our citizens. We have been following guidance from the Department of Defense, the Centers for Disease Control and Prevention, and screening all service members entering our armories and training sites. In short, because of these measures, we are in a position to be able to respond. We are prepared to support our local and state authorities in any way we can. Based on our past experience, support being provided in other states, and the nature of this pandemic, it is anticipated that there will be a varying array of missions that we might become involved with. Missions might include helping to set up community-based testing sites, as the governor just mentioned, operation of those sites, providing interstate transportation of personnel and equipment for medical or testing support, and logistical support to local and state authorities as needed. In fact, I'm sure there are needs that will come out of this pandemic that we aren't even aware of yet, but rest assured, your Missouri National Guard will do whatever we can to help. Let me end by saying that I'm extremely proud of our citizen soldiers and airmen. Your Missouri National Guard stands ready to serve our neighbors, families, and friends in the communities in which we live and work. We will train, fight, and win this war against COVID as a team and come through this stronger together. We are, in fact, one team, united as Missourians and Americans, and we will win together. Thank you.
General, thank you. Needless to say, with the leadership of General Compton and the men and women that serve the Guard here in Missouri, and I will put them up against any unit in the United States, and for them to be on the front lines to help with the COVID-19 situation, we're blessed here in Missouri to have the leadership like General Compton and the men and women that serve the Guard here in Missouri. As a number of the COVID-19 cases increase, we know there have been a lot of questions about support for Missouri's healthcare system, such as hospital bed space, overflow locations, and isolation sites for healthcare workers. One of our primary objectives is to do everything we can to support the healthcare delivery system and ensure hospitals have the equipment they need. We have tasked Missouri Healthcare Net Director Todd Richardson to help coordinate many of these efforts. Todd is here with us today to give an update on where they're at on the assistance they're providing against the fight on COVID-19. Director Richardson.
Governor, thank you, and thanks to the other cabinet directors and state departments that you've tasked to help with this important mission of supporting our healthcare delivery system. As the governor has made clear, one of our central priorities and responsibilities in dealing with this outbreak will be to support Missouri's healthcare delivery system. We have been engaging in regular and systematic communication with our healthcare partners to assess their capacity, their staffing needs, and their need for supplies. We have a great team assembled across state government that includes the Department of Health and Senior Services, Department of Public Safety and SEMA, the Department of Economic Development, Higher Education and Workforce Development, the Office of Administration, the Guard, and many others. We have already taken action to streamline the application and licensure process for Missouri healthcare providers. The Department of Health and Senior Services and Department of Public Safety have been taking delivery and distributing critical personal protective equipment. Director Dixon and his team have worked to identify housing support that can be deployed for affected healthcare workers. And finally, let me say this. Missouri is fortunate to have great healthcare systems, both big and small. And there is significant capacity and will to deal with this outbreak. That capacity is expanding every day. But the backbone of our healthcare system, are those dedicated first responders and healthcare workers that are on the front lines every day, providing care for Missourians and keeping us safe. Every day, they give Missouri their very best, and they deserve our very best, and that's what they're going to get.
Todd, thank you very much, and thank you for the job that you're doing. Kelly, let's turn it over for some questions right now, if you got a few questions.
I do. I've accumulated various questions from the reporters that have sent in via email or text, and then I do have a common question from constituent services. So we'll begin with you, Governor Parson. This reporter, Sebastian Martinez Valdivia from KBI in Columbia. Governor, would you consider overruling city or county executive orders that you think are too restrictive?
I would not. I have the confidence in the mayors across the state of Missouri to make those decisions for their local communities. And I think it's important that we support them on those decisions. We have our order in place, they have theirs, and again, I think the most important message out of this is to make sure that people understand how important it is to abide by these orders.
Okay. This question is also for you, Governor Parson, from Jacqueline Driscoll, St. Louis Public Radio. The governor says the vote on the supplemental budget is a priority. Is the governor asking for a vote within a certain time frame?
We are under guidelines for the supplemental budget. I had a meeting with leadership yesterday. We spoke to them. It's crucial we get that supplemental done, and that drop dead date, I would say, would be April the 24th. So we have to get it done for that. My understanding is the legislature are trying to figure out a plan to come in here somewhere around the 1st of April to get that done. But we all understand the importance of getting that supplemental budget down. And for the people who maybe doesn't understand the supplemental budget, what we say, but that is the funding source for the federal money coming in to gives us the authority to accept it and to spend it. And it's much different on the state level as it is on the federal level, where we can just continue to make, we can't continue to make money like the federal money or like the federal government can. We have to be able to abide by the Constitution and say we spend within the in the format that we have.
Okay. The next question will be for Director Richardson. Director Richardson, this is also a question from Sebastian Martinez Valdivia from KBI in Columbia. She'd like to know if there are emergency facilities set up to provide intensive care units in rural areas.
We're working every day to assess the capacity, not just in our large population centers, but across Missouri. And as we get a more accurate picture of what that capacity is, I believe that Missouri's healthcare system and the systems both big and small are going to have the capacity to handle this with the state's support. And we're going to do everything in our power to support our healthcare delivery system, but also to augment capacity where necessary.
Okay. This one also is for you, Director Richardson. This is from John O'Sullivan from KMOV. There was a study from the University of Washington that was sent out today with various data and numbers. And the ultimate question is, what is the state doing to bridge the gap on needed hospital beds and the ICU beds?
It starts with making sure that we support the expansion of capacity within our existing healthcare systems. And so that means first, our health systems, many will already have seen, have taken action to reduce their inpatient admissions today. They've also taken the steps to reduce elective surgeries to free up capacity that may be necessary to support. They're also making big changes and big structural changes, and I'll call everyone's attention to the work that Steve Edwards and the Cox Healthcare System are doing in Springfield today. In just a few weeks' time, they've managed to add 50 intensive care units at Cox Hospital. That's the kind of thing that's happening across our state right now, and I'm confident that with the state's support, we're going to have the capacity we need to deal with this challenge.
Okay, thank you. All right, this next question is for General Compton. I have a question from Rudy Keller from the Columbia Tribune. He'd like to know, General, will any units or personnel be called to active duty?
Well, hey, as I mentioned in my opening statement, we are working closely with our state and federal partners to provide a coordinated, unified response, and we are ready to mobilize at the needs that the Guard can bring to bear to support the civilians and citizens of our great state. Thank you.
All right, Dr. Williams, I have 2 or 3 questions for you. This one is from Lucas Geisler from ABC 17 News. Missouri and Kansas have each tested roughly the same percentage of the state's population. Missouri has a higher rate of positive cases than Kansas. Do you have any explanation for why Missouri's rates may be higher?
Thank you for the question. We've had about 670 positive. We're doing anywhere from 1,000 to 1,500 tests a day. As we see that positivity rate increasing nationally, we're also seeing that we've been quoting 6 to 8%. It's looking more like 10% now. Half of the cases in Missouri have been in two areas, St. Louis City and St. Louis County. So we think that following the trend that you're seeing nationally, you're seeing more cases in urban areas, unlike in northern Italy where it started out in rural communities and went to cities. What you're seeing around the United States is more urban clusters. And so we think that reflects what we're seeing here in Missouri. And we'll see, again, if we're doing 1,500 tests a day, 1,200 tests a day, we fully expect that we'll see about 120 positive a day, which reinforces the governor's message, is that social distancing is more incredibly important than ever.
All right, this one, Dr. Williams, is also from Jacqueline Driscoll from St. Louis Public Radio. Can we have an update on how many Missourians have been tested, and do we have enough tests for them?
We have tested about 7,000 people. We keep up with it daily, coming in from about 8 to 9 labs. More labs are coming on board. As we work out our strategy, we obviously would like to have more testing. But on the other hand, we think we're getting to a place where we're seeing what we need to know, which is that social distancing is really important. We have enough positives now that we know that there is community transmission, and we know that community transmission can end up in our high-risk groups, like nursing homes. And so we will be doing more testing. We have the equipment and more labs coming on board. But at the end of the day, the tests serve two purposes. One is to isolate those people that won't spread the disease, but it's also very much a message to the community of the importance that the disease is prevalent, especially in those two counties, and people really need to practice social distancing throughout Missouri.
All right, my final question for you, and then I have one last one for Governor. This one is from Sarah Oakson from DC Report, and she asked, what is the procedure for getting ventilators from our state, or for our state? And how many ventilators are there?
Thank you for the question. Daily, the Missouri Hospital Association provides a list of all the ventilatory capacity in the state, how many are being used, how many ICU beds are being used, how many are available. We have 123 ventilators that the state owns, that we have a process for distributing those regionally as they're needed. That's very well laid out. We work very closely with the Missouri Hospital Association in that. We've ordered 220 more ventilators for the state of Missouri should we need them. So again, our message always is hope for the best, prepare for the worst, and working with Todd and the Missouri Hospital Association and Director Parson and the governor, we feel that we are prepared for just that.
Okay, thank you. All right, Governor Parson, we have one last question for you. This is a common question amongst our constituents of Missouri. Nearly half of the governors in the country have issued a stay-at-home order in their state, yet you still have not. Even though the largest metro areas in the state have and are calling on you to adopt these orders, Governor, are you going to change your position?
Every day I come in here and talk to Missouri people, I tell them to stay at home. Every day. We're following the guidelines of the CDC. All of this changes daily to where we may make those decisions, and that decision might change tomorrow. It might change from a week from now. But right now we're following those guidelines. Every day we're trying to tell everybody during this 15-day period to stay at home. And we're going to continue to do that because that is the answer to how we slow the COVID-19 down. And again, whoever sets the rules, it's a matter of following the guidelines. And we are doing that now, as we say every day. You need to stay home if you don't need to be out. All right, let's finish up with that. As I've said throughout the COVID-19 response, we will continue to pursue every possible way to protect Missourians and help them recover from this crisis. And we will get through this, and we will be okay. But as I have said, it is going to take all of us working together. Again, the most important step Missourians can take right now is staying at home as much as possible. Every day you need to be thinking about how this affects others, not just yourself. We all need to be thinking about our families, our friends, and our fellow Missourians. The more people reduce their public contact, the sooner COVID-19 will be contained, and the sooner we will overcome this challenge. Thank you very much.